ZOLGENSMA, onasemnogene abeparvovec-xioi, is a prescription gene therapy used to treat children less than 2 years old with spinal muscular atrophy, SMA. ZOLGENSMA is given as a one-time infusion into the vein. ZOLGENSMA was not evaluated in patients with advanced SMA. ZOLGENSMA can increase liver enzyme levels and cause acute serious liver injury or acute liver failure, which could result in death. Please continue watching for additional important safety information.
My name is Maria. I've got 4 children, Sienna, who is 14, Felicia, who is 10, and I've got twins, Mila and Luis, who are 3 years old. My son is Luis, and he's got spinal muscular atrophy, type 1. I know roughly the development of a normal kid. They tell you put your baby on the tummy. Tummy time is very important. So we used to do that for Luis and Mila would lift up her head, and Luis wouldn't, so he would be stuck. Try to turn, trying to lift it up, and it wouldn't.
That's when we started noticing that it started getting worse. Less movements, not hungry, wasn't eating. He was pushing away from the food. Eventually he'll just move one arm and then just drop it. The movement will get less and less as the day goes on, and that's when we had to go and find out, went to a doctor.
It's really pure luck. I went to the doctor, it was an old doctor, and I said, look, you will think I'm crazy. I know it's a newborn, it doesn't move a lot, but there is something wrong. I think it's floppy. And the doctor looked at him and he said, yeah, it looks a bit floppy. I will send you as inpatient to see that he's okay. So we did the blood test and we had to wait. The pediatrician called me back on the Sunday and I said, did you receive the result? And she said, yes.
She explained to him, said, it's SMA1. And that's when my wife gave me a call, and that's where everything just went to pieces.
Luis had symptoms at less than 1 month. He was diagnosed at less than 2 months.
So we just looked on the internet, we'll look it over and over and just try to find something, saying there has to be something out there. It has to. We did our research and we found there was a study.
The gene therapy happened in October 2015. The doctor came and they did an infusion. After 1 hour, it was done.
Patients will receive an oral corticosteroid and will need blood tests before and after infusion with ZOLGENSMA.
I remember the day of Louis' treatment as a second chance in life.
We started seeing changes in Lewis in 4 weeks. Little movements on his little fingers. And then the next probably 8 weeks, we started having elbow movements. Just arm raising up and he'll drop it. And we just got a little excited. Before he got the treatment, I think he'll only move his eyes. Just his eyes.
My day with Luis will start, so he wakes up in the morning and so he can't walk. We have to move him in a chair. We give him food. Otherwise, afternoon, or we put him on his stander. You've got some equipment for a kid who needs special care.
In Lewis's life, you got acupuncture, chiropractor nearly 2 times a week, swimming once a week. He has physio, I'm sure it's about twice a week, and we just try to keep that system going for him as long as we possibly can.
Look at you standing up, clever boy.
Every day he does something new, it's a big achievement. Today my biggest achievement is that he could stand for 1 minute. with IFO and against the wall. If you would have seen me 2.5 years ago, it's, oh my gosh, he can hold his head. If you would have seen me 1 year ago, my biggest achievement is like, oh my gosh, he can sit, so everything is, wow. And it's after 3 years post-gene therapy. So after 3 years, the gene will make him stronger. There is no magic. You have to work hard, so. I hope he's like, he's the best he can be. I know he's happy boy, he can talk, he can sing. So my biggest hope is that he is independent in life.
Ask your child's doctor about the one-time infusion with ZOLGENSMA. Please continue watching for indication and important safety information. Indication. What is ZOLGENSMA? ZOLGENSMA is a prescription gene therapy used to treat children less than 2 years old with spinal muscular atrophy, SMA. ZOLGENSMA is given as a one-time infusion into a vein. ZOLGENSMA was not evaluated in patients with advanced SMA. Important safety information. What is the most important information I should know about ZOLGENSMA? ZOLGENSMA can increase liver enzyme levels and cause acute serious liver injury or acute liver failure, which could result in death. Patients will receive an oral corticosteroid before and after infusion with ZOLGENSMA and will undergo regular blood tests to monitor liver function. Contact the patient's doctor immediately if the patient's skin and/or whites of the eyes appear yellowish, if the patient misses a dose of corticosteroid or vomits it up, or if the patient experiences a decrease in alertness. What should I watch for before, during, and after infusion with ZOLGENSMA? Infections before or after ZOLGENSMA infusion can lead to more serious complications. Caregivers and close contacts with the patient should follow infection prevention procedures. Contact the patient's doctor immediately if the patient experiences any signs of a possible infection, such as coughing, wheezing, sneezing, runny nose, sore throat, or fever. Decreased platelet counts could occur following infusion with ZOLGENSMA. Seek immediate medical attention if the patient experiences unexpected bleeding or bruising. Thrombotic microangiopathy, TMA, has been reported to generally occur within the first 2 weeks after ZOLGENSMA infusion. Seek immediate medical attention if the patient experiences any signs or symptoms of TMA, such as unexpected bruising or bleeding, seizures, or decreased urine output. There's a theoretical risk of tumor development with gene therapies such as ZOLGENSMA. Contact the patient's doctor and Novartis Gene Therapies, Inc. at 1-833-828-3947 if a tumor develops. Infusion-related reactions may occur during and after ZOLGENSMA infusion. Seek immediate medical evaluation if signs and symptoms of infusion-related reaction occur, which may include rash, hives, vomiting, shortness of breath, respiratory symptoms, and/or changes in heart rate and blood pressure. What do I need to know about vaccinations and ZOLGENSMA? Talk with the patient's doctor to decide if adjustments to the vaccination schedule are needed to accommodate treatment with a corticosteroid. Protection against influenza and respiratory syncytial virus, RSV, is recommended, and vaccination status should be up to date prior to ZOLGENSMA administration. Please consult the patient's doctor. Do I need to take precautions with the patient's bodily waste? Temporarily, small amounts of ZOLGENSMA may be found in the patient's stool. Use good hand hygiene when coming into direct contact with patient body waste for 1 month after infusion with ZOLGENSMA. Disposable diapers should be sealed in disposable trash bags and thrown out with regular trash. What are the possible or likely side effects of ZOLGENSMA? The most common side effects that occurred in patients treated with ZOLGENSMA were elevated liver enzymes and vomiting. The safety information provided here is not comprehensive. Talk to the patient's doctor about any side effects that bother the patient or that don't go away. You are encouraged to report suspected side effects by contacting the FDA at 1-800-FDA-1088 or www.fda.gov/medwatch or Novartis Gene Therapies, Inc. at 1-833-828-3947. Please see the full prescribing information.